Medicosis perfectionalis, let's talk about APGAR score. So APGAR score was introduced by a female doctor named Virginia APGAR. The 5 letters here, APGAR: appearance, pulse, grimace, activity, respiration. 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 This score is measured after 1 minute and also after 5 minutes from delivery. Okay, why after 1 minute? 1 minute will assess how the baby or the neonate did perform in utero and during delivery. Okay, what about the 5 minutes one? This shows how did the neonate respond to resuscitation, if any resuscitation was performed. Okay, please beware that APGAR score cannot predict the outcome of the neonate. For example, a neonate can have an excellent APGAR score and still have like a disease or suffer or deteriorate after that. So it does not predict the future. It's only an assessment to the recent time. However, of course, a baby with a high APGAR score is more likely to perform better than one with like 2 APGAR score. So it's not an accurate prediction of the outcome. However, it shows you like who is more likely to survive. Okay, the score is from 0 to 10. 0 is horrible, okay, and 10 is the best. Okay. So, every letter of these, like APGAR, 5 letters, each item will have 2 points. So the highest number is 2 times 5. These are 5 times 2 equals 10, which is the best. Okay, now let's see. So you can go with appearance, pulse, grimace, activity, respiration, or there is a mnemonic called HRCTR. So APGAR, HRCTR. APGAR, HRCTR. Nice. What's H? Heart rate. So if the heart rate is 0, you get a 0 score. If the heart rate is less than 100, that's 1. If the heart rate is more than 100, that's 2, a score of 2. What about respiration? Respiration. Okay, if the baby is not breathing at all, that's a 0. If he's just like kind of trying to irregular shallow gasps, that's a score of 1. If the baby is actively crying, that's a score of 2. Of course, the neonate does not cry like in tears when he is just born. It's just an illustration. Okay. So, then we have the C. C is the color. If the baby is blue all over, that's a 0. If only the extremities are blue, but he's kind of pale, that's a 1. If he's pink all over, trunk and extremities, that's a score of 2. Then we have T, which is a tone, the muscle tone. If there is no muscle tone, that's a 0. If there is like weak or passive tone, that's 1 point. If there is an excellent active muscle tone, that's a score of 2. What about R? R is the reflex. Notice there isn't like a hammer here. The reflex hammer. So that's for reflexes. So the reflex or the reflex irritability, if there is none, like there are no kind of any reflex from the baby, that's 0. If there's kind of facial grimace, this is a 1. If he's actively like kind of moving and coughing, sneezing, that's a score of 2. So APGAR HRCTR, APGAR HRCTR, heart rate, respiration, color, tone, and reflex irritability. Each item gets 0, 1, or 2. So this baby has 0 in the 5 categories, so the total score is 0. This baby has 1 times 5, so he gets a score of 5. The third baby is excellent. He is everything to the fullest. He will get a score of 10. In real life, 10 is very rare. Why? Because there is something called transient cyanosis. When the baby is born, it's normal that he will be kind of bluish, which will decrease the score, but that's normal if it's only temporary. Okay, so 7 or higher is good. 90% of neonates will be born with a score 7 or higher. This is definitely good. Less than 3 is horrible. Okay, less than 3 is really bad. Okay, and there is an increased risk of neurological damage, such as cerebral palsy. Okay, what about 4 to 6? It's kind of intermediate, and you should consider resuscitation in both of these, kind of making better. So you can start with kind of back massage, or even oxygenation, oxygen mask, or even intubation if it's so severe. So if resuscitation is needed, you'll have to continue measuring the score even after 5 minutes, and you add 5 minutes each time. So first time will be at 1 minute, then 5 minutes, then 10 minutes, then 15 minutes, and so forth, to see how the resuscitation is affecting the neonate. Is he or she improving or deteriorating or just neutral? So the score at 1, how the neonate performed in utero and during delivery. 5, how he or she is responding to our efforts of resuscitation. APGAR HRCTR. Okay, so in summary, appearance, pulse, grimace, activity, respiration at 1 minute, and then at 5 minutes. Score 7 or higher is excellent. 0 to 3 is horrible. 4 to 6 is kind of okay. We should try to improve both of these. Okay, trying to make them better. HRCDR is heart rate, respiration, color, tone, and reflex irritability. This baby has an increased risk of cerebral palsy. This baby doesn't exist in reality because he will start with kind of transient cyanosis, but that's okay if it's only temporary. So make sure to do APGAR scores, just like try to memorize it, because the question will describe a baby and will give you the 5 characteristics, and you have to score each on the APGAR score to get the total, and then you assess, is it good or is it bad. That's APGAR score. Hope you liked it. Please subscribe to our channel Medicosis Perfectionalis for a new video every week. Thank you.